Hi class, my name is Torrin Harwell and I'm going to be discussing mental illness as my oral presentation topic for this week. Throughout time, there have really been four main components of mental illness. Those are harmful behavior, both to yourself and others, unrealistic thoughts and perceptions, inappropriate emotions, as well as unpredictable behavior. While there's the four main kind of components of mental illness or abnormal behavior, there's also three main explanations or approaches that have been used throughout time. Those are the supernatural explanation, psychological explanation, and biological explanation. The first one we'll talk about is the supernatural explanation. This viewed the cause or ailment, the cause of the mental illness to be from a demon or a bad force that was inside the individual. This was really prominent during the Middle Ages. It is not so common now. During this time, was when we saw those famous witch hunts, which we've all heard about. The main treatments during this time were bloodletting, trepanation, magic, exorcism, something that would relieve the person of their bad spirit. Without the removal of the spirit, the person would not be cured and would continue to have their ailments. The next approach is the psychological explanation. This viewed psychological factors as the key cause of the ailments, such as stress, anxiety, traumatic events in the person's past. So the main way to treat these would be by recreating the traumatic event, doing a dream analysis, or teaching the individual new skills. This approach is still supported and somewhat used today, but it is not the main approach or explanation that we would use. The main approach that we would use would be the biological model or the medical model. Both are one and the same. Hippocrates did a big part in pushing forward this medical model, even though during the Dark Ages we kind of strayed from it and went to those supernatural forces. The medical model viewed abnormal behavior similar to as a physical disease, where there is a cure like within the body, so they kind of viewed malfunctioning of the brain to be leading to this abnormal behavior. So when it came to treatments, we saw a lot of natural methods being used. We saw kind of like focusing on the body and the brain during treatment. Not necessarily looking at like an unconscious or looking at traumatic events in your past, the dreams, or even bad spirits. So now that we kind of discussed briefly those explanations and some of the treatments associated with them, I briefly want to discuss two key figures, in my opinion, that really helped push forward mental illness and kind of their treatments. First would be Pinnell and his ability to really unchain people dealing with mental illness, both figuratively and literally. He literally removed their chains, thus making them appear human again. Kind of lost sight of that when first dealing with them. And Leitner Whitmer, how he changed the field of psychology into that clinical setting, where we viewed it as not just kind of a tool for individual differences or how to view behavior, but actually a tool to use and help individuals. So I hope you guys learned a little bit more about mental illness this week, and have a good rest of your week. Bye.